Welcome to the Putnam County Library Lunch and Learn. Today we are joined by Brittany Gaw, who will be discussing Gentiva hospice care. Take it away, Brittany.
Good afternoon, everyone. My name is Brittany Gaw, and I'm a hospice care consultant with Gentiva Hospice here in Cookeville. Thank you all so much for being here today. Today we're going to clear up some common myths about hospice, talk about what a hospice benefit actually includes, who may qualify, and the easiest ways to get services started. My goal is to bring clarity, comfort, and confidence to a topic that many people feel unsure about. So here's what we'll cover today. We'll clear up some of the biggest hospice misconceptions. I'll walk through exactly what the hospice benefit includes. We'll review who is eligible for hospice. And finally, I'll explain how simple it is to start services either through your doctor or by calling Gentiva directly. By the end of this presentation, you'll feel much more informed and empowered. So what is hospice really? A lot of people think hospice is a place, but hospice is actually a service, and it's completely focused on comfort, dignity, and quality of life. Hospice care is provided wherever the patient lives, their home, a family member's home, assisted living, or a nursing home. We support the patient and the family. Hospice helps relieve pain, shortness of breath, anxiety, confusion, and other symptoms that interfere with comfort. So myth number one is hospice means giving up. This is the myth that we hear more than anything else. But the truth is, hospice is not about giving up, it's about living better. When the symptoms are managed and support is in place, people often eat better, sleep better, breathe easier, and feel more peace. Many studies actually show that people live longer on hospice because they aren't spending their final months in and out of the hospital. Families almost always say the same thing: we wish we would have started sooner. Myth number two is that hospice is only for the last few days. Another extremely common myth. This may have been more the case 30 years ago, but now we want to come on board to provide support as early as we can. Hospice is usually intended for the last 6 months of life, not the last few days, and patients can stay longer if their disease continues to progress. When people start hospice early, they get more support, more resources, and more time to focus on what matters. When someone waits until those final days to start hospice, they simply just don't have enough time to fully reap the hospice benefit that they are entitled to. So myth number three is you must stop all medications. This is absolutely not true. Hospice does not come in and take all of your medications away. We continue any medication that helps with comfort or safety, things like inhalers, insulin, thyroid medication, blood pressure medications, and anxiety meds. Our goal is to reduce unnecessary medications that are burdensome or no longer helpful, not to take away medicines the patient truly needs. Myth number four, hospice means less care. Hospice actually provides more care, not less. Your hospice team includes a registered nurse, hospice aides, a social worker, a chaplain, volunteers, and a nurse that's available 24/7. So instead of feeling alone, families feel suddenly supported from all sides. Patients are seen regularly throughout the week, usually 2 to 3 times a week with nurses or 2 to 3 times a week for the aides, which allows for closer monitoring and better symptom management and more support for the family. Myth number five, hospice is expensive. People are often surprised by this. Hospice is covered 100% by Medicare, Medicaid, and most private insurances. This includes comfort-related medications, all medical equipment, supplies like briefs, pads, wound care, and all nursing and support visits. There is no cost to the patient for hospice services. Myth number six is that hospice speeds up death. This myth can be very scary for families, but the truth is hospice does not speed up death. Comfort medications are safe, carefully dosed, and monitored by trained clinicians. Our entire focus is on easing pain, breathlessness, and anxiety, not doing anything to shorten a person's life. And sometimes the added support that hospice brings can improve quality of life with close management that actually helps some people live longer than if they would have without hospice. Myth number seven is only cancer patients qualify for hospice. Hospice is for anyone with a life-limiting illness, and cancer is only one of many. Other common hospice diagnoses include heart disease, COPD, Alzheimer's and dementia, Parkinson's, kidney disease, liver disease, ALS, stroke, and general frailty. If someone is declining, losing weight, falling, or spending more time in the hospital, they may qualify. If someone isn't sure if they have a qualifying diagnosis but still has this overall decline, you can always call us and we can eval and collaborate with their providers to see if there's any way that we can help. So who may qualify for hospice? Eligibility is based on an overall picture. So you have to have a life-limiting illness with a prognosis of 6 months or less, and a decline in health despite treatment. We look at changes in appetite, mobility, breathing, cognition, how much help they need each day. It's very individualized. And we also really look at how you're doing now versus 6 months ago. So how much did you weigh then versus now? What was your activity level? Things like that, just to really give us that overall picture. Signs that it may be time include multiple ER visits, falls, weight loss or poor appetite, increasing confusion, worsening shortness of breath or requiring more oxygen, needing more help with bathing or walking, or a caregiver who is just really overwhelmed. Often families know something is changing before the doctor even says it. So let's talk about what the hospice benefit includes. It's an extremely comprehensive insurance benefit. It includes a nurse case manager. They will be coming throughout the week, like I said, usually 2 to 3 times a week, where they'll check vital signs, do a full assessment. They're the eyes and the ears for the hospice physician. And they are also available 24/7 if something were to happen. So our goal is to avoid the ER, so if you need the nurse to come out, they're always just a phone call away. It includes a hospice aid for personal care, so they come 2 or 3 times a week as well for bathing, either get the patient in the shower if they're able to, or do a really good bed bath, whatever the safest option is. It covers all comfort medication, so pain, anxiety, nausea, shortness of breath, anything that makes someone feel more comfortable. And then equipment like hospital beds, oxygen, wheelchairs, walkers is provided as well. Supplies, so bed pads, briefs, wound dressing, those types of things are included. And you get the support of the social worker and the chaplain. So if there's any resources that might be available out there, the social worker can help with that. Also have difficult conversations like funeral planning or end of life decisions. And then the chaplain's there for spiritual care, just to be extra support and talk through things with the patient and family. And then once again, you have that 24/7 availability. All of this is at no cost to the patient. So we'll talk about what hospice does not do. To set clear expectations, hospice does not provide 24/7 in-home sitters. So while we are available 24/7, we are not in the home 24/7, and we want to make sure that someone has the support that they need when we are physically not there. We do not take over anyone's finances, so that still falls on the patient and their family, but we are there to help with anything that we can as far as, helping answer questions or get you in touch with the right people to get those things figured out. We do not require people to stop all medications. Like we said before, it's a very individualized approach, and we're going to adjust meds to fit someone's needs best. We do not require people to leave their home, so we bring all the care to you in the home setting. And we do not prevent the natural progression of disease. So when you come on to hospice, you know that there is a terminal illness at play, and instead of trying to fix the underlying problem, we are focusing on comfort and symptom management. We support comfort and dignity, but we do not replace full-time caregivers as well. So how to start services, there's 2 very simple ways. And there's a few different ways actually that fall into this first category of asking your primary care provider. Your doctor that you see routinely, you can ask them to send a referral for hospice. If you are in the hospital, the doctors there can also do that. Or if you're in a facility, they can send a hospice referral as well. So that all kind of falls into that category there. You also have the option to call Gentiva directly. You can reach out to us and we kind of do the heavy lifting for you on our end, where we will reach out to your providers, get records, see if we have the documentation to support eligibility, collaborate with the doctors with getting a hospice order, just to make that a simpler process for you. Families are shocked at how easy and stress-free we can make the entire process usually. So what is an informational visit? An informational visit is a free, no obligation conversation with a hospice nurse or care consultant like me. We explain what hospice does, answer questions, learn the patient's goals, and help determine if hospice is appropriate. It can take place in the home, in the hospital, or a facility, wherever is easiest for family. I've even had times where if there's been a patient in the hospital and there's a wife that can't make it out, I don't care a bit to drive out to your home. So whatever is the easiest thing for the family, we will accommodate the best we can. And this is just some contact information. We have an office located here in Cookeville. We are here to support our community. If you ever have any questions about hospice, whether for yourself, a parent, or just general curiosity, please reach out to us. I've included my contact information here. I've also got some cards set out. If you think maybe you or your loved one might be interested in our services, we'll just have a conversation with you. No obligation at all, just to see if there's any way that we can be of support and help our community. But I appreciate your time. I appreciate those of you that have come out, and you just let us know if there's anything we can do for you. All right?
Thanks,
Sounds
Brittany.
good.